So glad to have my guests here today to talk about epilepsy. They're both with the foundation, Pam Bryan and Susan Holloway, and both of you are involved with the Epilepsy Foundation of Middle Tennessee. Thanks for coming in.
Thank you for having us.
Let's start with Pam. What is epilepsy? I know you're a caregiver for your son. Tell us about his situation, how you got involved.
Okay. My son, 27 years ago, was in a car crash when he was 13. He sustained a severe brain injury and a spinal cord injury, and as a result of the brain injury, he does have seizures. So that's how it led me to want to help others, to give back. Epilepsy is a neurological condition that affects the nervous system. Individuals are diagnosed with epilepsy if they have at least 2 seizures. What's important to know is that epilepsy is not contagious and that it is not a mental health illness.
And Susan, not all seizures are the same. We know that. And what are some common types of seizures?
Oh, there have been stated by United Kingdom in some of their videos that there's 40 different types. I call the national organization for ours here in the United States, and they say, well, we've never put them all together, but there are a lot. For example, if I'm blinking and I'm just kind of tuned out blinking, that could be a seizure. If I'm wringing my hands, if I'm sleepwalking like, it could be a seizure. All of these different types of things could be a prerequisite to a major seizure that we know of as clonic-tonic, where we are on the floor. Used to be called a grand mal.
That was what I was going to ask you about. That was most familiar.
And most people know it as that, but it's been changed to clonic-tonic because of the tight muscles and the jerking. And that's where the names come from. So there's many different kinds, and you know, I, as a teacher for 36 years, was never taught to look for those things in my class. I might have just thought somebody was taking a nap or whatever.
Distracted.
And distracted, get tired, sleepy, and it's not, may not be so.
So Pam, in your son's case, it was brought on by the accident and the brain damage, correct?
Right. Correct.
What other causes are there for epilepsy?
Other causes are strokes, Alzheimer's, illnesses that cause problems in the brain, such as encephalitis or what's the other, meningitis. There's just tons of genetic factors can cause seizures, and 6 out of 10 have no known reason for them having seizures.
Could that be genetic factors that people aren't aware of?
Yeah, and doctors run all kinds of tests, and it's frustrating to the individual to not know why they're having these. But
of course.
The good news is that they are treated. They are able to treat these seizures with seizure medications.
That's the good part of it. Okay, so how is it diagnosed? Either
Well,
one of you.
the interesting part of that is I've been 5 years now teaching classes with the Epilepsy Foundation. One day, an elderly couple in their 80s came up to me after I had given the class, and she was pulling him along saying, come on, you've got to go see if this woman knows exactly what you've been doing to me. You've been ignoring me, you've been shutting your eyes, you've been all these things. So she was getting on to him for the way he'd been acting. He was just smiling and coming along behind her. They wanted me to diagnose if he had epilepsy or not. And the thing that I had to tell right off was, you, ma'am, are going to become a very big factor in the diagnosing of him. You're going to write down every time he has a seizure. You're going to take how long it lasted. You're going to talk about what maybe happened before. Was he working in the yard and he got real hot? Or all these sort of things. And then you're going to take that to a medical doctor, because I cannot do that. Only medical doctors can diagnose those. They may use some tests.
So you almost need to journal it.
Yes.
To keep track of what's going on, a diary, if you will. How is epilepsy then treated? You mentioned there are drugs.
Right. We do have medicines.
Are the medicines pretty effective?
With maybe 60% of the people.
60%.
And the other, types of people are just at what to do without medicine. So then they've come up with many other things, and some of them are a piece of equipment. They have like the VNS, the RNS. These are all little mechanical things that are implanted different places, and they then catch the flow of the electricity currents and help diagnose what's going on. They a lot of times make them less effective, or like for example, if you were going to have a seizure and the VNS was hooked to a nerve, well, it then sends a message to the brain not to do what it's doing, and it helps lower it some.
Okay.
So there's all kinds of things like that we're doing.
I see. What are some tips if you see someone having a seizure, but you're not familiar with seizures and that particular patient? What do you do?
The first thing to do is the hardest thing to do, and that is don't panic. Remain calm. My son's had seizures for 27 years, and if he had one today, it'd be just as frightening for me as the one he first had 27 years ago. But there are ways you can help. You feel kind of helpless when somebody's having a seizure, but some of these ways are: first, time the seizure.
Time it.
Time it. From the minute it starts to when it ends. This is very important. Make sure if the person is having a tonic-clonic convulsive type seizure that they're laying down, you turn them on their side.
Okay.
You make sure there's no objects around them that could be dangerous.
Okay.
You put something soft under their head because you don't want them banging their head on the hard surface, like a pillow, your coat, whatever soft.
Okay.
You just make sure that you stay with them until they're awake
Till
and
help
fully alert.
comes. Thank you so much, both of you, and I really appreciate you coming in. And thank you for watching Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.